Hey everybody, I want to welcome you back to our YouTube channel, and on this video today I'm actually going to show you what a really healthy mouth looks like. So one of the questions that we get asked all the time is, I have tooth wear, but isn't that normal? And as we get older, our teeth are going to wear out. That is not normal, and it doesn't always have to be that way. Oftentimes though, as we do get older, if we do have any type of bite issues or TMJ, TMD issues, or tooth grinding, wear, etc., you'll start to see the teeth break down and wear down. Doesn't mean that it's normal and or healthy, it just means that it does happen. It's kind of like a lot of people have the initial stages of heart disease. It doesn't make it healthy, it just means that a lot of the population has it. So again, not necessarily healthy. This is a scan of a patient that I wanted to show you that was a real patient that came in about a week and a half ago. And I wanted to demonstrate that even though there aren't perfect things about some of the teeth in this bite, and obviously with a scan we cannot show every facet of muscles and joints, but when I look at the teeth during an exam, it does tell me a story and it tells me a lot. Now, if you were to guess how old do you think this patient would be, my guess is you would think probably early 40s, maybe late 30s. The color of the teeth is a little bit darker. There's a couple things that we're seeing, slight areas of recession, etc. on the teeth, when recession is basically where the gum tissue falls away from the tooth, but maybe early 40s. This patient is actually in their mid-50s. It's a male patient, and very little tooth wear here, like none at all, and that's fantastic. So I wanted to show you the scan, and I'm going to show you the top teeth and the bottom teeth separately, so you can see that as we get older, it doesn't necessarily mean that our teeth are going to wear down. Okay, so when I look at these top teeth, for example, I want to show you what some tenets of health will look like, so that when you're looking, maybe you're looking at your own teeth. I don't know if you do this or not, but if you're looking at your own teeth and you'll see that they start to become flat and straight across, that's not necessarily a healthy thing. So I'm going to remove the bottom teeth so we can actually look at these top teeth. Okay. So the first thing you'll notice with the top teeth is I want to, in isolation, look at this canine tooth right here, this canine tooth right here, and then these lateral incisors right here, and then central incisors right here. Okay, so these 6 teeth. Okay, I want you to pay attention to those 6 teeth. And what you're going to find is that your canines, which is this guy and this guy, are naturally a little bit longer than your lateral incisors, which is this guy and this guy. And there's a reason for that. It's that when you move side to side and forward and back, these lateral incisors actually should be able to move past the lower teeth without bumping into each other. Okay? And then you'll notice these central incisors are a little bit longer again, and they're typically the same length as these canines. Okay. Now, without boring you to death, and that's not what this video is meant to do, there's reasons for that, and it's all in guidance patterns. So when you move side to side with your teeth or forward and back with your teeth, your front 2 teeth and your canines are guiding teeth. And your lateral incisors, the side front teeth, are meant to kind of just be along for the ride. Okay? And when those things are functioning properly, it eliminates a lot of bite issues on these back teeth, so the back teeth don't bang into each other the whole time. Okay, so the one issue with these scans is when I'm looking at both of these teeth together. Right now we're looking at the bottom teeth, and you'll see that if I turn this over, very little wear on any teeth. Okay, and very straight, not crowding, not malalignment, maybe a little bit, but again, we're talking about a mid-50s male. This is very mild crowding for somebody in their mid-50s, okay? This is very healthy. So if I look at this, and you can actually start to see this, if I took this patient's bite and I slid his jaw out towards me, his lower jaw towards me, there would be space that's created that lateral incisor, this side guy right here, would be able to slide right past the lower teeth without bumping into him. Okay? And if we went side to side with this jaw in the simulation, you would see that his canine teeth actually guide all of the other teeth out of the way. So his lower canine and upper canine are the only 2 teeth that contact. When he moves, for example, if he was moving to the left, which would be this patient's left, he would only be contacting here and everything else would have a space. And if he moved to the right, only his right canine's contact and there's nothing but space. And when he moved forward or back, only his central incisors will touch. That actually happens in real life. The problem is with this scan, obviously we can't simulate jaw movements yet with the scan to show you those jaw movements. But one of the important things, and one of the things that I hope you got from this video, is we don't always just look at disease as dentists and what's wrong with somebody. We like to use models of health both in theory and in real life. And I remember when I saw this patient, I said, do you mind if I take a scan of these teeth? There's nothing wrong with them. I actually want to be able to show other patients what healthy teeth look like in real life for somebody that's done very little dentistry and has good, healthy, functional teeth. No TMJ issues, no headaches, no neck pain, no sensitivity on the teeth. Now, if I was nitpicking just a little bit with this patient, if I turn the model to the left, I can see little areas of recession and infractions here. Okay. Now, if this patient was in their early 20s, this would be very concerning to me. As you start to get in your mid-50s, that means that this is so slowly developing that I don't think this is going to be an issue for him at time. But it is something that we're going to continue to monitor, because even though these teeth are very unworn, if he loses the guidance on those canine teeth, what will end up happening is these back teeth will start to bump into each other, and we start to see those characteristic wear patterns that develop right at the gum line of these teeth. So again, this is one of the important things that we do here in this office, is we take these scans and we can actually go from one scan to the next and make sure that these areas have not changed over time. The little notches right by the teeth. Okay. And if I flip over to the other side, there's a little bit of a discrepancy there with the scan. We just didn't get that information. But very small areas of recession and what we call infractions, which are notching of the teeth. Okay. But I did want to show this scan to you because a lot of times what we're going to be doing is we're going to be showing you scans of disease, scans of breakdown, scans of joint issues, and what we see at the tooth level. But I do want to orient you to be able to show you what actually healthy, real-life teeth look like. And we'll do a couple of these videos as well, younger patients, older patients, and things that we're seeing, which help us make good diagnosis for our patients so we can give them the best possible care. So hopefully you got value from this. As always, if you got value from this video, I encourage you to like the video, subscribe so more people can see it. And if you guys ever do have questions, leave questions in the comments. And if you do need an appointment, leave a question or comment, and we'll be sure to make sure that we reach back out to you so we can get an appointment for you. So as always, guys, thank you so much for checking this out, and I'll see you at the next video.